Welcome to the Health Trip Podcast. My name is Jill Foose. I'm a functional medicine and integrative nutrition health coach. I created this podcast to bring you along as we travel down intriguing, science-packed roads, debunking old medical paradigms and perusing new innovative therapies and modalities with the finest functional medicine doctors, practitioners, and like-minded biohackers while living our best life. Enjoy the show. Hi, everyone. Welcome back to another episode on the Health Trip Podcast. Today, we are talking more about hair loss, and it is August, which means it's Hair Loss Awareness Month, and I want to help educate more midlife women going through the menopausal transition, understand their hair loss, and understand their options. Hair loss can be an emotional and distressing experience, especially for women, where societal expectations often place a high value on a full head of hair as a symbol of beauty, youthfulness, and health. Over 50% of postmenopausal women will experience hair loss. I am one of those women. Although my hair loss journey has been going on for about 25 years, I am primed to lose my hair, and I have half a thyroid. I'm genetically set up for hair loss, including high DHT levels. And we're going to talk about all the hormonal imbalances that also are connected to hair loss. My guest is back for a third episode with me. Dr. Lady Di is a dermatologist in the Chicago area, and she is a hair loss expert. And we are going to provide you with science-backed information, practical advice, and a sense of community so you can navigate this journey with confidence and knowledge. We're going to explore some of the causes and types of hair loss, and then dive really deep into all of your options that are both non-prescription medications and more herbal and non-invasive remedies to support your hair loss journey. A quick reminder that this is just education, and all the information you hear is great information to take back to your own provider to discuss your options in your unique hair loss journey and what's going to make sense for you. So without further ado, open your mind, sit back, and let's dive deep into women's hair loss. Hi, Dr. Di. Welcome back to the Health Trip Podcast.
Hello, good afternoon, everybody.
I am so happy to have you back. This is our third podcast episode that we're doing together. We did another one on hair loss, and we did one on skin health, but it is Hair Loss Awareness Month. And so I'm bringing out all the big guns here. You, Dr. Bauman, I just had him on last week. He said to say hi, by the way. And it's really important to educate women about hair loss during midlife, during this menopausal transition. And there's a lot of misinformation out there. So I really appreciate your time today. And we're going to talk about science-backed information when it comes to hair loss in women.
Absolutely, I couldn't agree with you more. There's so much, what I call Dr. Google information. Some are good, some are bad. Just like you said, misinformation, and we are here to set it straight.
Yeah, absolutely. Let's dive in with what the biggest drivers are for midlife women going through menopause and hair loss.
So when we talk about that specific stage in a woman's life, we really have to pay particular attention to the hormonal changes that is happening. So I'm not just talking about estrogen, progesterone, testosterone. I'm also referring to vitamin D, and then thyroid hormones. So all of these different hormones come into play. That's probably going to be one of the biggest drivers. Now, there's also a lot of other drivers, in the background, right? So we're talking about, your hereditary predisposition. So genetics is going to play a big factor. What medications, you are taking, at that particular time in your life, or what other concurrent diseases that you may have. It becomes really very complicated. Hairstyles that, if you are doing, products that you are using, so all these different things really contributes to the well-being of your hair and scalp.
Yeah, absolutely. Just a little bit about the genetic component to hair loss. So I have what's called androgenetic alopecia. So I'm just genetically wired to, have thinning of my hair. And that started for me over 25 years ago when I had half of my thyroid also removed. So I have these layers of different reasons and causes why I'm primed to lose my hair. Talk about genetic testing for a minute and share why you think it could be a really important tool to use in someone's journey.
Yeah. So genetic testing for me is a very important test. And, I am sensitive to the fact that it is not covered by your medical insurance. But, at the same time, if you think about the information that it can actually help you, because it can help guide us clinicians as to what would be the best medication that that can help the patients get to where they need to get. So what that means is these genetic testing really tests for those what we call SNPs, which are the SNPs stand for single nucleotide po- s-
Polymorphism.
yeah, nucleotide
It's a
polymorphism.
mouthful.
Exactly. So it's really your genetic variation. And so it's so important in taking that information, and it's helping me as a clinician, guiding me as to what potentially which medication will work better for you, for example. So I think when it comes to treating a patient for hair loss, I couldn't do it sooner. And that's what I always tell the patients. Time is an essence. It is really important that we get you on the treatment as soon as possible.
Yeah, absolutely. Just like women who are now becoming more aware of cardiovascular disease risk during menopause or type 2 diabetes risk during menopause, it's all about prevention and what we can put into play based on our genetics, based on our lifestyle, and based on our goals, right? If you don't care about your hair, then none of this conversation doesn't matter. And there are some women who don't care, but most women do care absolutely about their hair health. Um, Genetics also can show if you are sensitive to a hormone called DHT, dihydrotestosterone. If you're someone like me, and I do have that genetic variant, that my testosterone will increase the levels of DHT. So it converts to DHT, and that is on our hair follicle, and that triggers the release of the hair from the hair follicle. And can you just talk about how much trouble that poses for women if they are prone to high DHT?
Yeah. So as you alluded to, not all women are gonna, have a, high, like not all women will have high DHT levels. And so, but for those women who does, it's derived from testosterone, just like you said, and then it gets converted to DHT. So when you have higher DHT levels, just like you said, it causes exodus of your established terminal hair follicles or those mature hair follicles from your scalp. But at the same time, it also miniaturizes your hair follicles so that over time, it kind of appears smaller and smaller. And then really studies have shown that if you talk about years and years of no treatment, they eventually disappear. So they kind of like fall asleep. And that's why, patients with this androgenetic, type of hair loss, their scalp looks, bald or, less hair on the scalp.
Yeah. So you're talking about that miniaturization of that hair follicle, which is really interesting, right? So the hair becomes smaller and smaller in diameter. So it doesn't have that thick volume anymore. And then eventually, what you're saying is it stops growing altogether. And at what point does that hair follicle die? Is it years of being untreated that it just dies? And then the only way to get that back is going to be through like a hair transplant?
So I mean, it's really interesting because I wrote an article about, like, we actually looked at biopsies of patients who's had hair loss for 5 years, for 10 years, for 15 years, and then we looked at the number of the hair follicles that have miniaturized over time, and then we also counted the number of hair follicles that you can no longer see. So what we found, is that the more time passes, which is around 10 years, is when the hair follicles pretty much disappears. So when we talk about, treatment, we typically use 10-year as a guideline. We use it as a prognostic indicator. So do we really think that we're going to be able to get your hair back? What is the likelihood? And so we always ask, well, how long have you been having hair loss? So, and that's why that measure becomes an important, question to ask.
Yeah. So back again to this preventative approach to hair loss, the earlier the better. When you start noticing it, go see a dermatologist who's a specialist in hair loss or a hair loss expert. Um, and that brings me to another question, which I get all the time. How many hairs do you lose a day normally? Like, when should you start thinking, oh, this isn't normal and I need to go see a provider?
Yeah. So that's an interesting question because it's typically 70 to 100 hairs a day. But but we don't, it's going to be a little heavier on the days that you wash and, not as much on the days that you don't wash. And that's pretty natural. And you want to get an average of those days. So you can't just base it on, I mean, if you only wash your hair once a week, well, then, naturally you're going to have a lot more hair, which by the way, you should not be just washing your hair once a week. Yeah.
Absolutely.
But then as you can imagine, right, you'll have, a little bit of an exaggerated number of hairs, but it's typically anywhere from 70 to 100 hairs a day.
Okay, because I'm glad you said it, because sometimes I read in the literature that it's also could be anywhere from 100 to 200 hairs a day. And you're right. There's a lot of people who are going through hair thinning or shedding, and they think, okay, well, I'm not, maybe even their providers or their hair stylists told them, don't wash your hair more than twice a week. And that's just a myth, right? Because if your hair is going to fall out, it's going to fall out. And so what drives this anxiety for a lot of us, rightfully so, is when we skip these hair wash days and all of a sudden on day 3, you go to wash your hair and now you have up to 300 hairs possibly, and it's a handful, and it's devastating to look at, and it causes a huge spike in your cortisol and
Yeah.
anxiety, and that it's not a good idea. And I'm glad that you're bringing attention and awareness to that myth.
Which brings me to another answer to your initial question: what drives hair loss in, a woman in midlife? One of them is going to be stress level, right? Because the higher, stress level you have, it's very highly correlated to hair shedding. So that's another factor in addition to your hormones, your genetics, medications, lifestyle, your grooming practices. I mean, there are so many, right? I mean, for
Yeah.
the unfortunate, and I want to bring awareness because medications really plays a very big role. Medications such as antihypertensive medications can cause hair loss. If you happen to have breast cancer and you receive a specific chemotherapeutic agent, there are specific ones that can in some patients eventuate in permanent hair loss, which is really devastating. And then, once you get a diagnosis of breast cancer, it's not just about the treatment at that particular time, right?
Yeah.
Because it's also the treatment that you're going to be getting for the next 5 years, such as, the medications in the category of anastrozole. So, or what they call aromatase inhibitor. So that plays a big factor because I see so many women, female patients who's had breast cancer, who is on that particular medication, who is going through hair loss. So,
No, that's a very good point, because I wanted to talk about all the different types of hair loss, and chemotherapy is sort of a standalone where it's you're going through this process and this treatment, and you already know you're going to lose some type of hair loss. Like my mom just went through chemotherapy for bladder cancer, and she lost maybe 2/3 of her hair. She has it back now because we had a treatment plan waiting for her. But that is a unique situation that's happening far too much, and definitely is a player in. Well, let me back up. If someone does have breast cancer and they're going through chemotherapy. Does taking that genetic test help at all?
Um, yes and no, because when you are put on specific chemotherapeutic agents, right? You are bound to have what we call antigen effluvium because
Hmm.
chemotherapeutic agents, right? I mean, they work against actively dividing cells. And our hair follicle is one of the most actively dividing cell in the body.
Yep.
So, right. So it's targeting that no matter what type of cell, as long as it's just so that they can control the growth from the tumor formation. So that so if if you go through your tricho testing, it's nice to have it so that you can be prepared, number one. Or sometimes, there are things that you can't concurrently do while going on the chemotherapeutic agent. So you're sort of not completely stopping the loss or preventing the loss from it, but you can definitely help maybe mitigate, slow down the loss. So for example, I'll just throw it out there, you could be doing minoxidil while you are, going through your chemotherapy, and there is no reason why you can't. Um, and, in addition to doing your cooling caps, of course, to help protect your hair follicles. But that is an example of doing the tricho testing that will allow me to be able to say, is minoxidil isn't going to be, is that even going to be effective for you, for example,
Hmm.
if you didn't
Hmm.
have enough enzymes, So that's just an example where you can use tricho testing.
Yeah, that's really, really interesting. What about COVID and GLP-1 use?
Yes. Yes, that's always I mean, so I'll make a comment about the COVID because COVID is really interesting, and it's not just unique to COVID. I think any type of sickness or diseases that can cause that, inflammatory reaction in the body can increase your cortisol levels, hence, contributing to your inflammation and then causing the hair shed. Now, as far as the GLP one, oh my gosh, I have so many patients who is going through this massive weight loss in a short period of time where they're actually because what the GLP one like what this drug class of medications, they slow down the gastric emptying, right? When you slow
Right.
down gastric emptying, I do believe that they are having some micronutrient deficiencies that's been happening.
Mm.
That's why they are also, a lot of the patients are going through hair shedding. I'm not saying everybody, but there's a good portion of patients who is going, um, journeying through that the
Yeah.
a class of medications, but is also going through hair shedding.
It makes perfect sense because we know that if you are a chronic dieter, if you're someone who's lost a lot of weight really quickly, we know that that is going to cause telogen effluvium, right? And that stress induced, and it doesn't have to be an external stress as if you're like in a bad marriage or going through a divorce or moving. It could be an internal stress on your body. And as far as the micronutrients go, right, we get all these micronutrients from our healthy diet. And when we're not eating as much food, when we're under eating calories, when we're really not optimizing our protein, which we need for healthy hair and healthy skin and nails, that really has a detrimental effect on our hair growth cycle.
Yeah, I mean, I couldn't agree with you more. And I also do think that when you're not getting enough nutrients, I do believe that it also affects your gut microbiome,
Yeah.
and there's that connection, and so, hair loss really is very, very complicated, and you really need somebody to be able to address and look into all those systems because
Yeah.
they're all interrelated.
Yeah. So we talked about androgenetic alopecia, which is what I have, which is called or known as female pattern hair loss. We just touched on telogen effluvium, which is that stress induced. And for you listeners who might not know, when you have a stress induced hair loss, and correct me if I'm wrong, Dr. Dye, but that shows up 3, 4, 5 months later. And so one of the things that I've done on my journey, because not only do I have the androgenetic alopecia, but of course I went through a divorce, I've moved, I've had stressors in my life, which triggers more shedding. I have a hair loss journal. And my journal is a journal of all events that are happening in my life in terms of if I'm changing dosage of a medication such as my thyroid med or my testosterone or any of my hormones. It's if I'm moving, if something, good or something bad has happened in my life. And I
Mhm.
have this journal because all of a sudden I start shedding and I don't have to now guess and wonder what the heck is going on. I look at my journal and I'm like, oh, 4 months ago, this is what happened.
That's a very smart way of actually tracking your hair loss journey, because I think that is very, very helpful, because oftentimes people don't really associate what has happened to them, 3, 4 months beforehand is really the causality of what's going on currently. And then, yeah, so that's a very smart, very, very smart way of tracking. Yep.
Yeah, it's a good strategy. We also just talked about antigen effluvium, which is the introduction of a chemotherapy or radiation therapy. But let's talk about, before we dive into treatments, can we talk about traction alopecia? Because more Black women have this due to hairstyling. And I wanted to know in your clinic, what are you seeing with traction alopecia?
Yeah, so I see a lot of patients with traction alopecia, and just like you said, more common with African American descent, but you can really see it on, yep, really any race doesn't really matter. Like, so what I'm seeing is that when you repetitively put a lot of pressure on the hair follicles, because you're sort of causing micro traumatic injury to the hair follicles. That's really what's happening. And then over time, they're they're losing blood supply. You're causing increased fibroblast activity that can contribute to scarring. And some of these patients eventuate and develop this central centrifugal scarring alopecia. So there's a lot of that sort of uh, uh, overlap in these two diseases. But if you really want to keep it very separate, traction alopecia is typically on areas where there's, pressure bearing areas, because, you're you're constantly pulling it. Tight braids predisposes you to that, corn braids, um, so then over time, most of the time, if identified early, and this is where awareness really becomes important, you can actually reverse it. But literature has shown that over time, if you don't address it, it can cause permanent injury. So, and then central centrifugal scarring alopecia, that's another, whole different type of permanent scarring, hair loss, and then, particularly seen in African American group, but you can also see it in Caucasians.
So tell me again, what's the biggest difference between those two?
The biggest difference between those two for traction alopecia, right?
Yep.
So it's secondary to pulling,
Yep.
bleeding, right? And then the central centrifugal, it's primarily right here in the crown, and
Hmm.
you can almost mistake it for very early female pattern hair loss. But when you really elicit the history, they have history of lots of chemical use, hair straighteners
Okay.
use. Yep, there's actually a lot more to it, because genetically, this group of patients are more susceptible as well. In fact, they've identified a gene that makes this patient population susceptible to this, progressive disease.
Wow, that's not on the tricho test though, is it?
No, it's not in the tricho test,
Separate.
but you can still use the tricho test, though, because it will still allow us to be able to predict whether specific molecules, y- you know, uh, is this particular ingredient going to help,
Mm,
them in regrowing hair. So it's still helpful, and I still recommend that.
yeah. Yeah, a little later in the podcast, we'll talk about shampoos and what to look for. But I want to dive into treatments now. And I thought there's so many treatments and options out there, and it can get really confusing. So I thought maybe we would put these into buckets and start with topical treatments and also talk about some of the side effects to look for. And so I thought we'd talk about medications first, and then I want to move into more natural options because there are women who, and I would love for you to speak on this too, who are so afraid to take medications because they think the medications are really bad for you and that natural is always going to be better, but natural isn't always better.
I completely agree with you. I always start out by telling my patients that my patients who are most successful in regaining their hair are patients who are actually doing treatments from different categories of treatments, or just like you said, different buckets of treatment. And the first bucket of treatment that I always explain to my patients is going to be the medication. And why? Because number one, we know they work. Number two, they've been studied very well, and their safety and efficacy profile has really been worked out, right? And a lot of them are going to be covered by insurance. So these are going to be things that you're going to be doing lifelong. So, it becomes a quite an expensive journey. And I tell my patients this, it makes sense. And then when you think about, just like you've covered how complicated the mechanism of hair loss, right? We want to really target the treatment at all different facets or fronts of the mechanism. So medication wise, what do we have? There's only really two that has been, FDA approved for androgenetic alopecia or pattern hair loss. You have your topical minoxidil, right? And
Yeah.
then we do a lot of, off-label use of oral minoxidil for hair growth. And then we also have the um, finasteride that's approved, the oral finasteride that's FDA approved for hair loss. And so there's really only two as far as medication for androgenetic alopecia.
So talk about, let's start with the FDA approved topical minoxidil for women. It it comes in 2% or 5%, but 5% is marketed towards men, although a lot of women use the 5% and just skip over the 2%. And also it comes in an application of being a foam or sort of a dropper that you put all over your scalp. And it creates like it's kind of messy. Like a lot of women don't like it because it's not so easy to use.
Yeah, so there are the two types that are available, and the 5% is going to be more effective. So I typically just skip over the 2%, but the studies were in women was based on the 2%. But I would say I would highly recommend that you start with 5%. The difference between the liquid and the foam formulation, the liquid, just like I said, a little messier to use. But I do think that you get higher penetration with the liquid. But the negative downside to the liquid is that it has propylene glycol. So a
Mhm.
high percentage of patients will, or has a sensitivity to that particular ingredient. So what that means is clinically they will have irritation and itching. Foam, they have no propylene glycol, and the indication is just once a day versus the liquid, which is twice a day. But I do think that if you can tolerate the liquid, you get better absorption with the liquid. So that's really the biggest difference between the two.
And then we have oral minoxidil. And also talk about, I know you're going to also talk about finasteride, but talk about the mechanism of action that minoxidil is working on because finasteride is a different mechanism of action.
Yes. So the short answer to minoxidil is we don't really understand exactly how they work. So everything is more conceptually that it increases blood circulation or blood flow and then by controlling the calcium what we call calcium channels in the cellular membrane, and that's how you increase blood flow. Now, as far as finasteride, the way how it works, it's a 5-alpha reductase inhibitor. So what that means is it inhibits the conversion of testosterone to DHT. And if you guys recall, the hair follicles has DHT receptors, and that really is the culprit because that can cause miniaturization of the follicles and also um, causing the hair follicles to exit from the scalp.
So I like to think of it this way. Minoxidil helps to grow your hair and finasteride helps you keep your hair.
So I think you could simplistically think of it that, in both ways, but minoxidil really is very helpful in preventing the shed because it prolongs the growing phase of the hair follicle. So a portion of our hair follicle, when, like, when you understand the hair growth cycle, right? 90%
Mhm.
of the follicles are in the growing phase, and they go through this life stage of growing, resting, leaving the scalp to allow new hairs from coming in. So 90% are going to be in the growing phase. And then each hair follicle has a predicted lifespan. So that what that means is, your growing phase, specific hair follicles is destined to keep growing for 6 years. But if you have pattern hair loss, you actually augment that life cycle, you shorten that. So we know minoxidil prolongs that life cycle so that you have, more growth as well as decreased shedding. And then finasteride really gives you growth and keeps your hair. And then also it keeps the girth of, well, minoxidil is really good at increasing the diameter of the hair shaft, but finasteride can do, has the same benefit as well. Yeah.
And so you could also take oral minoxidil. You can
Yes.
take so an oral minoxidil comes in a 2.5 milligram tablet, and most doctors start women at the lowest dose
Yes.
possible. And then I'm at the highest dose. I'm now up to 2.5 milligrams a day. And then finasteride you can use topically in a compounded formula, which I want to talk about, but I also take it orally and I'm at the top of that dose. I went from 1 to 5 milligrams. So it's a very personalized
Right.
journey that you have to work with a hair loss specialist like yourself so that you can change the dosages if you need to. I recently had to change. I want to talk about the dread shed before we move on to the compounded, because I see this all the time, especially in online forums. I see it in my group coaching. Um, Women will start to take a minoxidil or even a finasteride, but mostly they're starting on minoxidil. It's the most popular place to start. And they'll see their hair just falling out. It's just this massive shed for it could be a very long time, up to 3 months.
Yeah. So so I tell the patients that, it's a blessing in disguise, right? Because hair shedding is definitely one of the potential side effects of taking oral minoxidil. Eh, o- o- or just using topical minoxidil can also lead to, hair shedding. So it doesn't matter what form of minoxidil, because what it does, it's resetting the hair cycle, right?
Mhm.
And it can last, just like you said, up to 10 to 12 weeks, initially happening as early as 3 to 4 weeks, and then lasting for that long. Then the other thing, I always say it's a blessing, because if it's happening, then you know it's working. Because if it's not happening, sometimes you don't really
Yeah.
know if it's going to work, because minoxidil efficacy really is only what 50 to 60% of the patients. So not everybody's going to respond to minoxidil. Um, because it's complicated, right? Because you've got the oral or you've got the topical, everybody has different enzymatic, numbers on their hair follicles, presence of the enzymes. So you really metabolize these things at a different rate. But just to answer your question, it takes around three, starts at 3 weeks, lasting around 12 weeks. It can happen in up to 30% of the patients. And but if it's happening, it's a good sign.
Yes, and this is not the time to quit, ladies.
Yes.
This is the time where most women quit. They say, forget it, I can't go through with it. And then what's going to happen is your hair goes back to where it was before, and it's going to continue to shed, the way it was before. So I always like to tell people when you go speak with your provider, make sure you understand that by choosing a medication like this, you're choosing it for life. This is a lifer.
Yes. Yep. I mean, I always, make a joke about it, because it is forever, forever and ever. You can decide to stop it, but then if you stop it, you are going to lose the benefit that you've received. And not only that, it will take you back. I mean, it will take you to where you would have been at your biological stage in life.
Yeah.
I mean,
Right.
it's really important to, because patients will always ask me, oh, so, if I grow 100 hairs from it, so I'm only going to lose 100 hairs. I said, yes, plus more, because you're like 5 years older. So,
Yep.
right? So.
Yep. Yep. Very important to know. What about topical spironolactone or oral spironolactone? This is a medication that has to be prescribed. It's also a DHT blocker. Talk about that, and also why would you choose that over finasteride, or would you be doing choosing both of them?
I actually like to use these things in combination, especially with minoxidil, because spironolactone, just like you said, it is an anti-DHT. So mechanistically, it works very different from minoxidil. And I like the balance because minoxidil over time can sometimes cause water retention. And spironolactone is also a diuretic. So it sort of balances it out. So I like to, incorporate. I mean, that's like one of my favorite things that I like to do. However, though, when we're talking about women in midlife, I mean, I try to, I mean, I really want to keep everybody healthy, so I'm a little bit more I would say sensitive to the kidney function, as you get older. So I'm really trying to preserve every organ I possibly can. And so I less likely choose spironolactone, and I gravitate towards finasteride, because I do think that spironolactone over time is harder on your kidneys.
Interesting. Let's talk about the compounded topicals like Formula 82M, 82F, and also we didn't really talk about dutasteride if you want to talk about that as well.
Yep.
Um, and just talk about these compounded options that might work because we said previously that topical minoxidil can be very messy, whichever delivery, the foam or the serum that you go with. It could be messy in that or irritation on the scalp, which could be two huge reasons why someone would say, absolutely not, I'm not going this route.
So, so let me make a comment about dutasteride, because the dutasteride is the most potent anti-DHT, right? So,
Yep.
I mean, there are, I mean, I totally respect the fact that, these medications can have, some systemic side effects. So if you're one of those patients who's not able to tolerate it, or it's not safe for you to use, then there is an alternative option of you can do a topical, form of a combined formulation, minoxidil, dutasteride, finasteride. So a lot of these really can be combined, and you can apply that topically, and that could be a safer way for some of these patients. Or maybe you can start out that, you can start out by using the topical. If it works, then we can maybe later consider doing the oral. So there's really a lot of different ways on how we can approach it, and really tailor it to the specific needs of the patient.
Yeah. So these compounded formulas called 82M, for example, is 82 minoxidil. And I actually use that. I don't use the regular minoxidil. I like it because I have wavy hair that's multi-layered and like to style it. And it's a topical and a little uh what's it called?
Dispenser
Little,
bottle,
yeah,
right?
a little dispenser bottle. And I just put it on my head, about 30 drops on the cap area in the morning and then in the evening. And what I like about it is that it has that ingredient in there that dries immediately on impact when you put it on your scalp. It doesn't run down your head. It doesn't run down your face. It just is sort of a spot drop and a dry.
Yeah. So I agree. There's lots of varieties that we can offer, and I think that's something that the audience need to know, is that, they have so many choices nowadays.
Yeah. And also that is not covered by insurance and it is more expensive. And so I always like to tell people you have to think about your hair loss budget. And we're going to talk now about some non-medical therapies that can get really expensive, right? They're really effective, but they're really expensive. And I have a hair loss budget. This is something that's really deeply meaningful to me to keep my hair and to keep it healthy. And so I've sacrificed other things in my life to make sure I can do and maintain the things I want to do for my hair loss journey. Everybody's looks different, but definitely having a budget in mind, I think, is a really important thing. And also the commitment to the long-term approach and what the maintenance is, the daily maintenance, and then maybe the annual maintenance. So let's talk about these non-medical therapies. What's Let's start with what's your favorite?
Okay. Yeah. I was just going to say in that bucket of category, it keeps growing. There are so many options now. So I would say, I don't really have a favorite, because I really look at all these systems, of what's contributing to this person's hair loss, right? And then based on what I see, like lifestyle, for example, if you're somebody who's super super busy, you really can't come in, and get any of these treatments, so I may recommend that, hey, you're probably somebody who should get a laser, cap, because you can use it at home, for example. So we know that low level laser light therapy, it works. It's been studied, gosh, it's been FDA approved since 2007. There's a lot of data behind it that if it's something that you can do at home, you definitely should do it. But there has been a lot more innovation since then. So if you're somebody who, is non, like you just can't do that because you're just not somebody who is a consistent route, you don't like routine, right? So then I'll just have you come into my office and then, I can give you this new ultrasound treatment, called TED by Alma Laser. And TED stands for transepidermal delivery, which I think you had,
Yes,
right?
with you. Yep.
Yeah, and then it's not painful.
Nope.
Yeah, it's very comfortable. It just feels like warm, hot stone massage, and then you get that once a month, for 3 months. But everyone's going to be different. I've recommended some, once a month for 4 months. Really, it all depends on what's driving your hair loss, and are you also doing concurrently other treatments? Because if you are, then you are less likely to need this treatment for maintenance. So your initial treatment is a series of 3 to 4 for monthly treatments. And then after that, depending on how you're doing, you can do it twice a year, you can do it once a year. And if you choose not to do anything else, then you may have to do it every 3 months for maintenance. So really all depends. Now segue, when we talk about, PRP, for example, that's been around for a very long time. So that's platelet-rich plasma therapy. Um, we harness the regenerative powers of our own body from the platelets basically to heal and grow hair, repair and grow. It can be painful. So that's what I have to say about that, but it does work and you need to continue it as well. Now, there's also laser assisted delivery methods, called Carelase. That's another treatment that, I have at my practice, fairly new treatment, but the whole premise is using the laser energy as well as creating micro channels on the scalp tissue and dropping the growth factors into the tissue. And these growth factors are synthetically produced and made in the laboratory that's designed to promote hair growth or stimulate your hair follicle cells.
Is that one like PRP where it's with needles?
No, it's with the laser.
Oh, the laser, right.
Yeah.
Oh, okay. Hmm.
So you create the channels and then which will, because with the ultrasound, we use the synthetically produced growth factors, but guess what? You can also use dutasteride or finasteride and drive that into the scalp by way of ultrasound. So that's actually what I've been doing recently and really has been designing it, depending on what on the patient's needs. So that's another way of getting the medication into the scalp if you choose not to take it orally.
So I just did a podcast recording with our mutual friend, Dr. Alan
Yeah.
Bauman, and he was telling me how he is running a clinical trial right now on including exosomes in the
Yes.
in the Alma TED protocol.
Correct. So I have actually been doing that as well. So that's another exciting thing of how you can drive the axis, which brings me to the next topic, which is actually exosomes, or under the category of regenerative medicine. That's what I call it. But you can definitely do exosomes. it can be driven by way of ultrasound, by way of a laser assisted type of delivery, because you can use lasers to create the micro channels, open up the channels and drop it in. Or you can micro needle it, right? So, it's a controlled needle that goes into the scalp, and you create these, little vertical channels, and then you can drop your exosome. So it's just thinking outside of the box on how can we deliver these active, components that we know can drive follicular growth.
Are stem cells something that is legal to use in hair loss in the United States?
No, it's not. Stem cells are definitely not FDA approved. And in fact, the use of exosomes is not FDA approved. So but the way how it's delivered is controversial, as long as you're not injecting yet. The stem cells is just completely out of the picture. And then exosomes are kind of left for our interpretation. And for the audience who doesn't, they may not know what exosomes are, but they are derived from stem cells, but they are called the messengers, right? Because they just carry information and they deliver that to the particular cell that needs the help. And that's how it works.
So who would be an excellent candidate for exosomes? I mean, I have my hair loss under control for the most part. Um, so I don't think that I could, if I had the money to spend on that, because it is very expensive, I could do it, but who is it really meant for?
So, um, so I, so for my practice, I use it for patients. Number one, they don't really want to come to the office. They only want to come like once a year or once every
Mhm.
10 months, right? So it's going to be for that type of an individual, and it's going to be for the individual who has failed everything, who can't tolerate any medication, who really cannot do any other concurrent treatments, because we know that to be successful in hair growth you really have to be doing multimodality. So if you can't do any of those, then I would recommend exosomes. And then for those who isn't lucky enough, in a position to be able to afford it, then a lot of these patients can do it as well.
Yeah. Let's move on to more nutritional and supplement approaches for the person listening who says, "Oh, this sounds all really cool and everything, but I want a very natural, herbal type of approach, but I want it science backed." And so we're going to have less options.
Yes.
Yeah, but so I had a couple questions about, let's start with dietary supplements. One is high dose biotin, like 10, is it 10 milligrams a day? Like, is there science on this? Yay or nay?
No, nay. Absolutely no science, but it's unfortunate that every I mean practically every supplement out there for hair will have some biotin, because it's all about marketing. But the idea of biotin supplementation for hair growth really came about from this one particular scientific report on a patient, on an infant actually, who has biotinidase deficiency. So they have a enzymatic deficiency of making biotin, so they don't have the ability to make biotin. So in that particular infant, when they supplemented that infant, a male infant, with biotin, he then grew all his hair back. So then as a result of that, everybody just started putting biotin in their products, because the consumers will not buy it if it doesn't have biotin. So that's unfortunate.
Yeah, that is really unfortunate. I can't tell you how many people I know that swear by biotin working for them. What about same thing with collagen, right? Collagen peptides.
Collagen peptides, definitely has value in hair growth, but again, same story. There's only very few nutraceuticals, out there that's really been studied scientifically to prove that it can, help hair growth. And so I only know of three. But that's also one of those things that, yeah.
So what I've read on collagen peptides is that the only one that I've read that has any efficacy or clinical trials behind it is one called Verisol collagen peptides, bioactive peptides?
So Verisol is actually one of them, because they're hydrolyzed bioactive
Mhm.
peptides. Nutrafol is another one, and Viviscal is the other one.
Yeah, talk about Nutrafol, as because we're talking about supplements here. That is, the go-to for many, many people online, and it's a place where many people start. It's expensive. It is not a cheap supplement. I forget the amount of money I figured out, but it was thousands of dollars annually to stay on this supplement.
Yeah, it's like for a 3 month supply, it's like around a little bit over $200 for a 3 month supply from their website, So I mean, you can get it a little bit less expensive than that, but um they've done a lot of well, I don't want to say a lot of studies. They've done multiple studies, so you can count them, but they've definitely shown that it can help hair regrowth in both men and women, but they've so what they've done, right, it's made up of fish collagen as well as phytonutrients, but they've addressed the different components or drivers of hair loss, such as um, your stress,
Yeah.
menopause, right, pattern hair loss. So they have specific ingredients there that specifically targets those components. And then and they have like there's different formulations. I think there's like I mean, for men, and then for
Yeah.
with menopause, and then like healthy women, and then they also have a postpartum, and then I think they also have a vegan uh a formulation. So there's definitely data, but the data that I'm familiar with, it's I mean, you'll be surprised. It actually only regrew approximately, I think, 10% of the hair um, after, consuming it for 180 days, which is a 6 month trial. So that's what they, so, 10% for some people, that's significant, but you kind of have to weigh it against, how much it costs, and then only you can decide whether that's worth it.
So if you are saying Nutrafol has shown to grow 10% back, how does that compare to something like minoxidil?
Oh, minoxidil, as a medication, it's going to be far more effective. So in the studies, it's regrown as much as 40% of the hair.
Mm, big, big difference.
Oh, it's a huge difference. And
Yep.
then, and then I want to segue to Viviscalis, which is one of my faves, actually. I mean, I do use Nutrafol. I think there is a place for the use of Nutrafol, but I very much do like Viviscal, because the science has definitely shown up to 30% regrowth, and there is so many more studies that backs the use of Viviscal, but it's also been around for far longer than Nutrafol.
Very interesting. Okay. I used to take Viviscal. It's like, when do you make the decision to go the medical route versus just sticking with the nutraceuticals?
Well, I think at the end of the day, it's really what you're comfortable in, because by the time that you are clinically like by the time your hair loss is clinically apparent, you had already lost around 25 to 30% of your
Yeah.
volume, right? So
Right.
so if you are somebody who is just trying to do maybe more preventive, because you know that you're going to be entering that stage of midlife, then as preventive, then maybe you just do your supplements. But if you're already going through it, then I would say the earlier the better for medical intervention, if you're
Right.
open to it. And doing it all is going to be really the best combination.
Yep. Yep. What about things like rosehip seed oil? I've read a lot of clinical trials to show that it's as effective as minoxidil.
Yeah. So there's been a lot of, yep, like the rosemary oil, right?
Hmm.
Yeah. So there's been a lot of, I would say, buzz and the internet, because they've actually shown it, online, but they only took very few patients. So I think the jury is still out.
Okay.
And so far, from my patients who has just anecdotally tried it themselves, I would say 50% has actually caused more harm, because because there's so many formulations out there. And what's important is you need to find something that's pure, that it's really just made out of a rosemary oil. So don't don't get something that has a lot of other things, because those can be sensitizers, and that can give you itching, allergies, and then now you're creating that inflammation on your scalp that can lead to hair loss. So just be careful, but I do think that the jury is out, on that particular oil.
Okay, good to know. Let's talk about shampoos and conditioners as we come to a close for the podcast. I think there's a myth out there that shampoo can help grow your hair, and I would like you to give us your professional opinion of that myth.
Yeah, so shampoo is, I always tell my patient, it's not going to grow your hair. But again, if you're looking at, like, doing multiple things to really help your scalp health, your hair
Mm.
growth, it can be in addition to what you're doing, an adjunct, but it's not going to be the reason why your hair is going to grow. And then, for example, right, the prescription shampoo called ketoconazole shampoo that's been around
Mhm.
for many, many years, that truly has an anti-DHT effects. And that's where, you'll find physicians always recommending that. And, there are shampoos that has anti-DHT, saw palmetto, for example. So that can be helpful, but it is not going to be the reason why you are growing hair.
Yeah. Oh, that brings me to a question about saw palmetto before we move on. Is saw palmetto you can take orally, right? It's just a nutrient. Um, do you see that that also helps as an anti-DHT?
Yes. There's definitely scientific literature to say that when they've done trials on male patients, so definitely it's helpful, but you need to know how much to consume of the saw palmetto. And I think that's where, if you go to somebody who truly is a hair loss expert, they should know that information. So
Right. So potentially you could take minoxidil and saw
yeah,
palmetto and not even start the finasteride at that point yet.
absolutely.
Right. So
Yeah. And
yes.
I've done that for for a lot of my male patients, because
Mhm.
they don't want, the sexual side effects,
Yeah, let's mention that real quick. Some of these medications, well, finasteride
Mhm.
can absolutely give you side effects, but I, so I take it. So I'm taking the highest dose orally at 5 milligrams a day, jumping from one. And I did think that I was going to have side effects. I do take testosterone. I use it as a topical cream. So I'm able to manage my libido also with that. So I did not have any sexual side effects. I was really concerned about that because it's already hard enough to keep that going at my age. um, but do you see it more in men than in women?
No, I mean, the sexual side effects is there, but it's rare. So I want to make sure
Hmm.
that your viewers know that,
Yeah.
because yes, these medications has side effects, but it's rare. I mean, then there's the post-finasteride syndrome as well that, a lot of people talk about. It is present, but it's single digit percentages. So I do recommend it. I just have this conversation with the patients, and I tell them the percentage, and there are ways to get around it as well.
I have one last question for you. When should someone stop hair loss treatments? Like when is enough for a patient?
So that's a difficult thing to answer, but I've definitely turned away some patients who, when they are in their most severe form of hair loss. So what does that mean, right? When you can pretty much see through their scalp, and I mean, what what we call the severe form of pattern hair loss. You could see their scalp. They just look like, balding, males. I turn them away, and I just tell them that, in my opinion, you've had it for 30 years. I don't think that it's going to get you better. Now, I, I, I guarantee I can get you better, but the question is it going to be cosmetically acceptable, right? And
Yeah.
then as far as, uh, you know, to answer your question, for the individuals who has mild to moderate, I would say it's really up to them, because I cannot speak for them as to when is enough, because it all gonna, that's very dependent on their judgment because it's about their effort they're putting in, their emotions, right? Because, yeah, so it's managing all that. And so I usually tell the patients, I will support you whatever decision that you and I come up with, and I will tell you the statistics, I will tell you the probability, but if you are willing to try, I will try, I will try it with you. So, yeah. So
Yeah.
it really is very patient dependent.
Yeah, at that point, they probably need to see someone like Dr. Bauman who does those FUE, the
And they could do,
follicular unit extraction transplants.
yeah. And then,
Yeah.
that's another thing too, because when they've lost their donor area, right? Like,
Yeah.
yeah. So that's another conversation.
Yep. Yeah. Well, Dr. Dye, thank you so much for joining me today to talk about something that is a really hard topic to talk about. Um, Anything coming down the pipeline in terms of female pattern baldness or just hair loss in general
Yeah.
for women?
Yeah, there's actually a potentially a new drug, a new medication that is going to come out. If it's going to be approved, it's going to be in 2026. It's a topical clacosterone, and clacosterone is an anti-DHT. So it's just a different chemical. I mean, it's now available for patients who has acne. And, they use it for that. But it's something topical that you apply that potentially insurance is supposed to cover. So I think that's coming down the pipeline. And then
Yeah.
and a lot of things under the regenerative medicine category. So that's another exciting area.
Yeah, that is a huge area and full of excitement. Just all those biohacking options
Yes.
that can get really expensive, but eventually sometimes the price does come down, sort of like red light therapy, right? Like, it's not crazy expensive. There's a nice spectrum of options within the category.
Yeah, I mean, I just want the viewers to know that with the exosome therapy, there are many different classes to the exosome therapy, and so some has actually now become affordable. So I do offer that at my practice, and then some are like, super expensive. But so I just want you to know that like what's affordable, you can use it as a booster to, whatever treatments that you're doing, so that it becomes less expensive.
Oh, that's so good to know. I'm gonna have to remember that the next time I
Yeah.
come in and see you. So
But
my routine now is coming in once a year to do the Alma TED. It's very relaxing. Like you said, there's no needles. It's like a hot stone massage. And it to me, because I've done PRP as well, the Alma TED to me produced the most hair growth quickly, the most visible so quickly. I was very, very happy with the results.
perfect. Well,
Yeah,
oh,
keep it going.
yes, always
Yeah.
nice that, we have a happy patient. That's
Yeah.
always our goal.
Yes, absolutely. Well, thank you again. It was a pleasure to see you and speak with you. I know that a lot of women listening are going to walk away with a lot of golden nuggets and might even be contacting you or their own provider. And just thank you so much for all of your wisdom and your expertise in this area.
Oh, you're welcome. And thank you for having me as well and giving me this opportunity.
Absolutely. Thank you for listening, everybody.
Yeah. Okay. Bye.
Bye. Thank you for joining me. I hope you enjoyed the podcast. Lifestyle changes can be hard and overwhelming to make. By building your support team of functional medicine doctors, therapists, and health coaches, you can reach your optimal health goals. Be sure to check out my other podcasts. Until we meet again, stay healthy.